Hi, I'm Dr. Mike. Today we're going to look at the Cox Flexion Distraction technique invented by Dr. Cox. It's very good for bulging discs, sciatica, low back pain, facet encroachment, and low back issues that aren't responding to typical chiropractic adjustments. We got Mr. Butler here with us. He's done fantastic with the flexion distraction method. So he came to us a couple years ago and he was in bad shape.
Couldn't walk.
Yeah, he was in.
I had to sit everywhere.
It hurt to breathe, it hurt to move, hurt to stand, hurt to lay down, numbness, tingling, sciatica. So we look up at the screen here, he actually had 3 level bulging discs. So the worst was at L4, L5 pretty moderate, and then mild at L3. So tough case, definitely heading for surgery. And then I said, he called me and we talked about his case, looked at his MRI, and I said, man, this is a tough one. So we're going to give it our best shot. And we took a look at his whole spine from the top down. We want to make sure that the spine's clear of interference. And then we're going to mechanically decompress these discs. So he's having a little back pain today, and we're going to demonstrate the technique. Slide up a little bit. All right, so the first thing I like to do is the flexion distraction tables, some have an auto feature. So we're going to start by just trying to get him to relax, get the tight muscles to let go. And we're going to use an impulse adjuster. And what's nice about using the instrument adjusters, when someone's in a lot of pain, the last thing you want to do is twist them, crack them, do a drop adjustment, because they're already antalgic and any little movement hurts. So what's nice about the instrument adjusters is we can get right on the L5, and we can start to get a little bit of movement in this bone. Then we can move up to L4, and when the segments are stuck and they're locked down, the muscles get very tight. So a lot of times some chiropractors will use electric stim to try to relax the muscles. And what I found with the instrument adjusters is we can get the bones moving a little bit, just enough to free things up and get the muscles relaxed. And then when we do go in there and do the decompression, it's going to be a lot more tolerable for the patient because they're not afraid that we're going to do something that's going to hurt them. So just a nice way to get in there and free things up. And then the table going up and down is already starting to create some traction in the area and open up the facet joint and start to decompress the area. That was a double beep, so that means it didn't change. Good. And then once we get things loosened up a little bit, we're going to put this in manual mode. So we're going to stretch him out to maximum tension. And then we're going to get right in here on the L5. And then we're just going to very lightly stretch that. So it didn't look like it moved much. How's that feeling on there, DJ?
Big stretch.
Big stretch. So the difference between spinal decompression, where you lay in a decompression table, and the flexion distraction method is we can target the individual joint, and I can actually create a negative pressure between L5 and S1 to suck the disc back in. And then we get some lateral bending in here, and it's just a great adjustment technique for people that are in a lot of pain. It's very gentle, it's very effective, and it's very good for disc issues that aren't going to respond to aggressive adjustments. And we can work very lightly in here and help these people that are heading for surgery and get them doing well. How's that doing?
Good, very good.
If you know anyone with bulging discs, sciatica, chronic low back pain, try to find a doctor that does the flexion distraction technique. And I'm Dr. Mike here at the Besso Clinic of Chiropractic. And if you need help with your low back, give us a call.